So tell me about your symptoms and pain. How was your life, or how is your life?
Well, I had my knee surgery, and I really felt that after my knee surgery I'd be perfect. But slowly my back started giving me problems. And when I went back to my knee surgeon and said I need my hips done because that's the area it was hurting, he said it's your back,
Yeah.
and he took
How
an
long?
X-ray of it.
Yeah. How long has this been going on? How many years?
I had my knees done in 2014, so then about 2015, 16, it
So almost
started.
6, 7 years now.
Mm-hmm.
So you are going down the hill for 7 years.
Yes.
I see you're in a wheelchair. How far can you walk?
I could walk probably 12, 15 foot.
That's it.
Yeah.
How does one live just being able to walk that long and not more?
Live in a one-floor home
Yeah.
and
Yeah.
have a wonderful husband that does
Good.
everything.
Excellent. How bad is the pain without medication?
The pain is severe without medication. It hurts to walk. It hurts to sit. It hurts to lay.
1 to 10, how bad?
Probably around a 10,
10.
is my worst.
Yeah, yeah. And and we looked at your films, this is what's going on. This is not a trivial thing. You have severe stenosis, we call it claudication, worse in the third, fourth, and the fifth disc from below, that practically totally correspond to your symptoms and explain why you're having the problem. So you're not a medical mystery. We know why you're having this problem. And you said you saw actually a surgeon in Nebraska.
Right.
Is that where you're coming from?
Yes.
Well, first of all, thank you for coming and seeing us, but you have a long drive to come to see us,
About
all the way
8
from the
hours.
8-hour drive.
She'd drive a long way to get rid of pain.
Yes.
Yeah. Why are you driving this long to
Well,
find a surgeon to help you?
Because my girlfriend Cheryl told me that I had to come and see you, that you worked miracles in her life.
Okay, well, thank you. But, well, why? I mean, you told me you saw a surgeon locally. Tell me about that. Tell me what happened.
Well, I went to see the surgeon at Nebraska Spine, and he told me that he thought he could do the surgery, and then I had an MRI and a CAT scan. And he seemed real positive before that.
Before he looked inside.
Right, and
Yeah.
then his nurse called me and said he wouldn't do the surgery.
Did they explain to you why?
No, he just said he was afraid my whole back would collapse.
Yeah, it was just too much for them. Or in my opinion, they probably did the right thing for you, because in open old-fashioned surgery, I apologize telling you, you're not 20, your heart and lung cannot take too much stress. Probably they weighed risk versus benefit, and they decided the surgery would be more damaging than helpful to you.
Right.
But they didn't give you any other option, like sending you somewhere else. I think that is
No.
where I can't fault them, that they didn't look around giving you other options. Just because they cannot help you does not mean you cannot be helped.
They had a pain doctor there, and he helped me with shots.
And medication.
And medication, and
Yeah.
I fight with my doctor all the time. In fact, I left that practice because his PA would not prescribe the hydrocodone
Yeah.
when it was due. And so I went to my doctor, my
You-
GP, and asked her, and she referred me to another office.
Yeah. You see, that's a very common story, that we cannot, or we are not able to fix your actual problem, and pain medication is the only thing left for you to live. And then, rules and regulation really put lots of limitation on us. So in a way, we doctors make people drug addict by not solving their problem. And then we as well have our own limitation to help the patient with the pain medication. So this is almost a vicious circle that there's no solution until the problem is solved.
Right.
How long has your procedure been around? Have you been doing
About 10 years.
10 years?
Yeah.
Yeah. And so why would other doctors not recommend something like this to you?
That's a good question. Now I see, I'm asked this question very often. Why are there so many pilots but only few people who can fly a space shuttle? Because it takes a lot more education to do that. And surgeons are busy. Once they get in practice, they cannot take months off to learn a new, or very few of them are willing to do that. And that is why there's nobody in Nebraska able to help you. For us, this surgery is a 1.5 hour surgery, usually 1 night hospital stay and half a coffee of blood loss. By us reducing the risks, your surgery become a routine surgery for us. So I can help you, and I will schedule you to help you and fix this problem.
That's great.
Super.
Yeah,
That's what we wanted to hear.
yeah, and I just want to emphasize that the other surgeon has the best intention, your safety in mind. We just able to do that surgery without putting you on a table for 10 hours or losing half a gallon of blood. That is why, without causing lots of damage to your spine. That's why we can do that.
My girlfriend had back surgery, and she said, you know why they call it back surgery? Because you have to keep going back.
Yeah, you have to keep going back. I like that one. I'm going to use that. Okay. Now, this is actually our first visit,
Right.
and we will start this process, get a medical clearance, and put you on a track to fix your spinal stenosis. What other comment or question do you have that you want other people in your situation know about? What would
I guess I have a personal question.
Yeah.
I have a brother that lived in Norfolk, Nebraska, 100 miles from Omaha, and he had severe back problems that came, and they rushed him to the hospital in Omaha. And trying to find out to check his heart, they went up through his groin area, and during that process, they cut
Nicked
something,
an
nicked
artery.
something.
Yeah.
And he was full of blood, and he had to have extra surgery to do that, and they had to pump, they said it was as big as a volleyball, you know, and they had to pump that out. And then they said, well, they thought his heart wasn't, he had to have stents, so they wouldn't do surgery on his back till he put stents in. And so now they said that they wouldn't put the stents in, which means he went back, or gonna go to a rest home and have to just recuperate there without, you know, any surgery. And he's got to wear a brace on front and back. I guess I'm sitting here thinking, is that something that, you know, that you could deal with?
We
him?
can definitely look into that, but let's take care of her
Right,
first,
absolutely.
and then we will deal one problem at a time. Okay. Now, there is actually a good news here. Your insurance, I'm assuming, is Medicare, because,
Right.
and lots of people say Medicare is a bad insurance and so on. I want to emphasize that why Medicare is a good insurance. Medicare never give me a problem to take care of you.
Oh, wonderful.
Yeah,
That was my next question. And
yeah. They
and we
never
have
give me a
Blue
trouble.
Cross Blue Shield, and they cover anything that Medicare covers. So
Yeah, and but what would you say if your insurance says the only kind of surgery you can get is open old-fashioned surgery, and then the other doctor says, nope, we cannot do that, it's not safe. What would you say to the insurance company, both of you? If insurance company says the only thing, the way we pay that, if they fillet you open and do that big massacre kind of surgery, what would you want them to know if your insurance would tell that?
I would tell them that they should look into the happy people that you've operated on.
Yeah.
And I mean, my friend Cheryl was ready to take her life because she was in so much pain. And you brought her out of that pain. And she was so ecstatic when I called her
Yeah.
so that she could tell me about
That's
you.
almost cruel and inhuman for administration, for a CEO of the company who get hundreds of millions of bonus, sit behind the desk, decide that you cannot have those small surgery.
Right.
You have to get a big surgery knowing that nobody's going to offer you that. That is, I think, the highest level of cruelty.
That's the biggest frustration, that they just said no and not offering an alternative, you know.
But it goes even beyond that. If the insurance all of a sudden condemn people, that's the open old-fashioned surgery that was the standard of care 50 years ago, is the only surgery you can get, and nobody's going to offer you, practically saving themselves a lot of money by doing
I
that.
don't understand.
Yeah,
you know,
some
why
people
they
have
would
to go
do
through that. Yeah, it's about saving money, and unfortunately, some insurances, especially like a health partner here in Minnesota, is exactly telling us that people in your situation, open surgery is the only thing they can get. Doesn't matter if you have an option for them or not. Okay,
Oh, that's ridiculous.
that is ridiculous
Yeah.
and cruel.
Yeah,
Yes,
it is.
it
That's the
is.
bottom line. That is
Yeah.
the word. It's
If
cruel.
you can do it faster
Less
and
blood
more
loss.
efficient,
You're
then
basically treating somebody like an animal and turning your back on them. You
Yeah.
know?
Well,
well, what's scary is the fact that when people get older too, they are not interested in helping people older.
yeah. Wow. Well, unfortunately, yeah, there's a truth in that. Well, but really, I enjoyed talking to you guys. And I thank you for sharing your story with me and the rest of the people who are out there having similar problem. Thank you so much. Okay.
Ron, thank you.
Well, you're welcome. Thank you.